Hello, this is Dr. Eric Chapman from Chapman WellCare, and in today's video we're going to talk a little bit about the shoulder joint. Shoulder pain is a very common thing that patients can experience, and you can see from looking at this model that when we talk about the shoulder joint, we're really talking about three specific bones and how they connect to form the dynamic mobility of the shoulder joint. One of the things that we do here at Chapman WellCare is sometimes when patients are in a lot of pain, we can relieve some of that pain with a shoulder joint injection. And a shoulder joint injection is usually the combination of a steroid with a local anesthetic. Let's talk a little bit about the shoulder joint. And we can see here that the joint of the shoulder is actually comprised of three specific bones. We have the clavicle or the collarbone, we have the scapula, and we have the humerus. And when we look at the humerus or the arm bone, we can see that the ball of the humerus or the head of the humerus connects with the socket portion of the scapula and what we call the ball and socket joint. And we can see that if we flip this around and we look at the back view of the shoulder, that there's a good entry point here when we're doing a joint injection. This is called the spine of the scapula, and a doctor can feel the back portion of the shoulder blade to make sure that we're using the right landmarks. And by injecting a needle into this space, we can bathe the joint with steroid and a local anesthetic. And when we flip this over, we can see that this tight little area, this tight joint, has a lot of different connections. And what this model does not show is all the different tendons and muscles that also insert into the shoulder joint. So whether it's a rotator cuff tear, whether it's a rotator cuff tendonitis, whether you're dealing with arthritis or other conditions, shoulder pain can be quite debilitating. Patients will feel pain when they're reaching overhead or trying to move their arm behind their back, or sometimes they'll feel pain at night when they're laying on the arm. And we use a multidisciplinary approach. We initially evaluate the pain here. We use our wonderful network of orthopedic doctors and specialists in town that we've developed relationships with. And in conjunction with maybe acquiring an MRI or an X-ray, there's a whole system that we can use that can help patients. So hopefully this video helps. If you have any questions, you can call us at 239-359-6500. Thank you very much. Have a good day.